Good afternoon, Doctor. Dr. Chris Baker here, coming to you from East Texas. Glad to be home in Texas. Today I thought we would talk a little bit about orthodontics in your practice. This may be something you're already doing, or it may be something you're considering, or it may be something you haven't considered at all. Either way, let me just talk to you a little bit about that. First of all, you know systems in a lot of ways better than most people in business. Dentistry is systems. There's a system as to how you cut a prep. There's a system as to how you do a pulp treatment. You have a system for how the patient enters the office, how you do an examination, how you do a treatment plan. You are full of systems. And by the way, I would bet you that those systems could get even better than they are. I certainly have discovered that to be the case. It's amazing how much better my systems are now than they were some time back, because I worked on it from that standpoint, and it changes everything. It changes how I go about things. It changes how much I have to do, a lot less than I used to. It changes how the staff can pick up and take care of their end of things because they know the system better than ever. It changes everything. It changes your income. Hey, that's a biggie. You know, here we are in business, in practice, to make a living, to make money, to take good care of patients and go home at the end of a day, end of the week, end of the month with income for us and for our family. Well, systems are your ticket. I just want to tell you. And now that we've talked a little bit about how you already are a system person, whether you think of yourself that way or not, I know you are. Now I want to talk to you about the fact that orthodontics is systems all over the place. That's all it is. All orthodontics is learning new systems. Sometimes old systems. Sometimes systems that you're already using with edification. The point is, orthodontics requires systemizing. And when you systemize, when you change the way you do things in orthodontics, or when you add orthodontics in a system manner, it will flow beautifully for you. It will give you the potential to be fee for service for orthodontics, which we can tell you how to do that. That's the way to do orthodontics, believe me. And as you look at orthodontics through your system lens, you will actually find that you can do it very, very well as you practice, as you learn, because like everything else, practice, 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 of course. Now, let me talk to you a little bit about orthodontics. First of all, orthodontics, if you're not doing it already, is going to take some learning from the inception. If you're doing orthodontics, offering those treatments already, then there's a lot more to learn. Oh my gosh, is there a lot to learn. Orthodontics has so much potential. It never stops teaching. It never stops being new. But it's a good thing, because with your system base, you can do anything. You can learn any part of it. So, okay, back to the whole idea of systems and orthodontics. So, if you're doing orthodontics, if you're offering this in your practice, then as you get with us, and what we do here at Element Seminar here in East Texas is we regroup continuously on how to make your systems work for you. How to make orthodontics a series of definable, written down, by the way, I strongly suggest, steps, which some people call a cookbook. Cookbook is fine. A cookbook is merely the instructions, the ingredients and the instructions when you think about food. And in your dental treatment, you could do a cookbook for every single procedure that you do if you think about it. And you can do one for orthodontics. I continuously use a cookbook approach, if you will, to what I'm doing in orthodontics for the patients, because it makes the treatment go better. The patients are happier. It shortens your treatment time, and it gives you less problems. So yes, I would suggest that knowing that you're a system person already, knowing that you would like to have an area where you could do fee-for-service dentistry, which will help you maybe get to where you can do fee-for-service dentistry, period. Get out of the insurance game, get out of the corporate game, get out of the relationships with the companies that are taking a lot of your money and reducing your ability to care as well for your patients. Yes, those are all things that you can accomplish. But start thinking about how orthodontics might be your entry. Start thinking about how you could come and learn with us to Elements seminars here in East Texas and learn to have an idea of how to go about it. Get yourself systematized from the beginning. Get yourself organized in a way that your staff can easily take on their roles. Get yourself ready for a fee-for-service practice that makes your patients happy, that makes the parents of your child patients thrilled, that gives you something that they talk about at the soccer games, in the supermarket, at school, in all of the different places that parents gather with their children. Your braces are going to stand out. So think about joining us. Think about coming and learning these systems approaches in ways that will enhance and heighten and increase your practice so beautifully and increase your joy and happiness with what you're doing for your patients. We would love to share it with you. It will blow your mind. There are people who are here that are doing this and loving it every time they walk into their office. So come and join us. Dr. Chris, signing off.